Hello students, today we will be doing general anatomy of joint movements. Now in the previous two videos on joints, we have seen what is the definition of a joint, and therein we studied immovable joints, those are the fibrous joints, the partially movable joints or joints with restricted movement, and those were the cartilaginous joints. And then we also saw the freely movable joints, those are the synovial joints. And we've already seen there that when we talk of movements occurring at a particular joint, these are seen as sets of movements and they occur along a particular axis. So when we go on to study the joint movements, we first need to know kinesiology, which is defined as the science of movements, and it belongs to biomechanics. Movements can be active or passive movements. Now, when we talk of active movements, in a joint where movement is free, the more movable bone will possess a larger articular surface. Example to be given here would be the shoulder joint, wherein out of the two bones, that is the scapula and the humerus is more movable, and hence if you see the articular surface of the head of humerus is 4 times larger as compared to the articular surface of the glenoid cavity of the scapula bone. So when the movements are limited, the opposing articular surfaces are roughly equal in surface area, or the bones forming the joint are congruent enough. And here I would give example of the hip joint, where the head of the femur articular surface is congruent with the articular surface of the acetabulum of the hip bone. So that's why here, since the bones are congruent enough, the range of movement is less, or the movements are limited. Now when we talk of types of movements, there are 4 different types of movements: gliding, angular, circumduction, and rotation. Now let us see gliding movements. These type of movements are seen in non-axial joints, that is in the plane joints, and the motion or movement here is limited. And the same is shown here, a plane joint wherein we see only gliding movements. And examples of these type of plane joints are the intercarpal joints or the intertarsal joints. Next we see the angular movements. These again are of 2 types: flexion and extension, and abduction and adduction. Now when we talk of flexion and extension, flexion means bending and extension is straightening, and these movements occur along a transverse axis. Now in flexion, the ventral surfaces of the bones that form the joint are approximated. There are a few exceptions to this, and those are the first carpometacarpal joint, the shoulder joint, knee joint, and the ankle joint. Example here for flexion and extension, I would give the elbow joint, wherein flexion means the action in which the ventral surfaces of the arm and the forearm are approximated to each other. And when this is taken back to the normal anatomical position, or when the joint is extended, the limb is straightened. So that is flexion and extension. Flexion means bending, extension is straightening or taking it back to the normal anatomical position. So what we see here is flexion of the shoulder joint, and this here is extension of the shoulder joint. This is the elbow joint showing us flexion or bending and extension or straightening. We also see a wrist joint here, wherein we see flexion and extension. Next we want to see the Second type of angular movement, that is abduction and adduction. In abduction, the part moves away from the median plane of the body, and in adduction, the part moves towards the median plane. This movement occurs around an anteroposterior axis. When we talk of the fingers at the metacarpophalangeal joints, abduction and adduction occurs, and the axis for this movement passes through the long axis of the middle finger. Whereas in the toes at the metatarsophalangeal joints, abduction and adduction occurs along an axis which passes through the long axis of the second toe. So what we see here is shoulder joint movement of abduction, where the upper limb is taken away from the midline of the body, and adduction, where it is brought towards the midline of the body. And this is the abduction and adduction occurring at the metacarpophalangeal joints, axis passing through the middle finger. So when the thumb, index finger, ring finger and little finger are taken away from the middle finger, that is when the fingers are fanned out, that is what is called as abduction. And when all the fingers are brought towards the middle finger, that is what is called as adduction. Similarly, what we see here are the toes. So at the metatarsophalangeal joints, the movement occurs along an axis which passes through the second toe. So when the great toe, the third, fourth and fifth toe are taken away from the second toe, that is abduction. And then when they are taken towards the second toe, that is called as adduction. So thus we have seen the two types of angular movements, flexion and extension, and abduction and adduction. Now we go on to see circumduction. This is a combination of the four angular movements so that the part or the limb describes a cone, and this is possible only in biaxial and polyaxial joints. So what we see here is the shoulder joint, which is a polyaxial joint, and we see here a combination of the four angular movements, a combination of flexion, abduction, extension and adduction, so that the limb describes a cone, apex of the cone being at the root of the limb. Similarly, here we see the hip joint, and again here hip joint is a polyaxial joint. So the limb describes a cone. This is called as circumduction, combination of four angular movements. Next we go on to see rotation. This movement occurs around a vertical axis. Example being shoulder joint and atlantoaxial joint. There are two types of rotations which are possible: adjunct rotations and conjunct rotations. Adjunct rotations are independent movements such as those occurring in the hip joint, shoulder joint and atlantoaxial joint. Whereas conjunct rotations are passive rotations that occur along with some other movements, and examples are knee joint and first carpometacarpal joint. Now in the knee joint, along with extension, there occurs medial rotation. Medial rotation here cannot occur independently. And the reverse, that is lateral rotation, occurs along with flexion. So these are conjunct rotations. Similarly, in the first carpometacarpal joint, Medial rotation occurs along with flexion, and similarly, lateral rotation occurs along with extension. So these are conjunct rotations, passive rotations that occur along with some other movements. So what we see here is adjunct rotation, that is independent rotation, which occurs at the shoulder joint. Now, the rotations at shoulder joint are always demonstrated with a semi-flexed elbow. So what we see here is medial rotation, and what we see here is lateral rotation. So these are independent movements, and hence they are called as adjunct rotations. Similarly, at the hip joint, medial rotation and lateral rotation occurring independently. So these are adjunct rotations. Whereas at the knee joint and at the first carpometacarpal joints, what we see are conjunct rotations. Then we go on to see passive and accessory movements. The structure of the joint may permit some movements by passive manipulation. Example is, head of humerus can be separated from the scapula by traction at the shoulder joint, provided the muscles are relaxed. So these are passive manipulations or passive movements. Accessory movements can be performed actively by a joint. An example here being grasping a solid object by hand, wherein rotation of fingers is seen at the metacarpophalangeal joints. So when you hold a tennis ball in your hand, that time when your grip is tightened, along with the flexion of the fingers, slight rotation of the fingers at the metacarpophalangeal joints also occurs, and these are accessory movements. Now that we have seen all the 4 types of movements that can occur in the synovial joints, let us now go on to see what are the factors limiting the range of movements. First is shape of the articulating bones. When the opposing surfaces are disproportionate, the bone with larger surface has more freedom of movement. Whereas when the opposing surfaces are congruent to each other, the movement is going to be having a lesser range. Next is the tension of ligaments. Ligaments permit desirable movements and prevent undesirable movements. So, the extension of the hip joint is limited by stretch or tension in the iliofemoral ligament. So ligaments here are limiting the movements. They are permitting desirable movements and they are preventing undesirable movements. Next is the tension of antagonistic muscles. When a particular group of muscles is contracting, the opposite group of muscles have to relax. So, if the flexion of hip has to occur, it has to be assisted by the relaxation of the extensors, which are the hamstrings. So tension of antagonistic muscles also helps in limiting the range of movement. And lastly, approximation of the soft parts. When we see flexion at the elbow joint, that is limited by approximation of the soft parts, that is approximation of the ventral surface or anterior surface of the arm with the ventral or anterior surface of the forearm. So approximation of soft parts also plays a role in limiting the range of movements. Now let us see what is the blood supply and nerve supply of joints. The blood supply of joints is done by the epiphyseal vessels that form a rich capillary plexus in the synovial membrane, which is called as the circulus vasculosus. Nerve supply of joints. The articular capsule and ligaments possess rich nerve supply. Sensory fibers control the posture, joint position, and pain, whereas autonomic fibers are vasomotor to the joint. And finally, we also need to know Hilton's law, which states that nerves which supply a particular joint will also give branches to the group of muscles regulating the movements of the joint and skin over the joint. So if a particular nerve is giving articular branch to a particular joint, it will also give muscular branches to a group of muscles which are prime movers for that particular joint, and it will also give a cutaneous nerve which will supply the skin over the joint. Thus, we have studied the general anatomy of joint movements in this video. Thank you.